Welcome back, welcome back. We have in the studio for the first time, we have James and Ellen Martin. They're massage therapists down there in Jasper, Arkansas, and they have a business called Massage for Health. And let's talk a little bit about that. Now, how long have you been down in Jasper?
We've actually been there a year and 2 months.
Okay. And where'd you come from?
Actually, we've been in Jasper for 5 years. We retired and came out of Bentonville area.
Yeah.
And to the most beautiful place in the Ozarks.
This is beautiful this time of year, isn't it?
Oh, yes.
Yeah. So let's talk a little bit about your business. It's massage. Is that
Massage for Health Clinic.
Okay. And does that encompass more than chiropractic arts, or?
Well, yes, massage therapy is in itself a therapy. And we've incorporated microcurrent therapy with that, which is a non-invasive treatment, neuromuscular treatment. And it's good for just about any aches or pains you might have.
Mm-hmm. So did you do that in the Fayetteville area?
Yes, we started actually in 1990 because of an accident that I had, quite by chance. A man worked on with microcurrent therapy after the other therapists weren't able to help us.
Wow.
And after a year of pain, he relieved it in five treatments over 3 days, and I was impressed.
And
so
no pain after that?
No pain, not even to today.
Well, what precipitates that pain? I mean, in your case, pain that will not go away. What was the underlying cause of that?
Actually, it was from a common chair, much like you're sitting in.
Okay.
In a motel room, it came apart in probably 6 or 7 pieces.
Oh.
And it injured my sacrum, which is the lower part of the back. Nerves in my neck, my ulnar nerve, which would be the one like your funny bone.
Yeah, yeah.
For a whole year, I had funny bone experience night and day. Wouldn't go away. I had to have surgery, or would have had surgery, in my neck to relieve the pain. And the neurologist said there's no way to get around it. And after he'd worked on me, we scratched the surgery. We scratched anything that would have had to been with injections in the spine. And I've been fine ever since.
So what prompted, or how did you come by going to massage therapy type? I mean, as far as you being hurt, did your doctor recommend that, or how did you?
No, actually,
Just an alternative?
since we'd worked with doctors for so many years and training them in a clinical setting, after we went to school for microcurrent therapy, we decided to go ahead and take the next level.
Okay.
And started teaching at a clinical level. And then recently, we wanted to have our own standalone license for microcurrent therapy. And they said, if you go to massage therapy school, you can earn that.
Okay.
And so we did. We went as a team. And we graduated, and the rest of it's been history.
That's
And you two are
interesting.
married?
Yes.
Okay. Well, that's nice. Husband and wife team.
So you've been in Jasper for the last 4 years.
Yes.
And you've started your business for a year. What kind of reception have you gotten from the people in Jasper?
Wonderful.
Wonderful?
Wonderful.
There's a need, obviously.
Obviously, there is a need.
Yeah.
We've had people come to us that have been to doctors and chiropractors, and they've been the whole gamut.
Yeah.
And they come to us as a last resort. And we have clients that say, oh, you don't know what you've done for me. You've given me my life back.
Yeah.
Wow.
Now, I'm sure this involves an electronic device or devices, and that therapy itself is what helps cure or help alleviate a lot of the pain. Is that what we're talking about?
That's true. But we learned early from massage therapy school that most of the pain was generated, of course, within the cellular level. And since microcurrent works on the cellular level and the nerve level, that if we combine the two together, that made a 1-2 punch that really would work on it. Because once you've relieved the pain for the microcurrent therapy, the body needs to relax and absorb that.
I see.
So
I
we work
see.
together as a team.
And you need to retrain the muscles. Because a lot of times the problem has come from not having the muscle strength.
Well, that's great.
What are some of the clients that come in for the audience out there? You had a fall.
Yes.
I'm sure people are going to have. Can this be long-term problems that they have that you can diagnose? How do you diagnose a problem? Can it? I just want to know what kind of patient that you are looking for.
We don't diagnose.
Exactly. We don't diagnose.
Yeah,
That's
okay.
something we're not capable of doing. But when they come to us, they might say, I fell off my tractor 15 years ago, and I've had a pinched nerve in my back all these years, and it's getting worse.
Yeah.
And so we take a look at them. We do an assessment. and then we say, here's a treatment plan that we think will work for you. And if it's something that they're under care of a physician, then we say we'd like to have the physician's authorization in letter form for us to go ahead and proceed. And so we work well with the chiropractors who we do get referrals from, and a couple of physicians as well.
So you don't, like we talked about earlier, you don't do the diagnosis.
That's correct.
So can someone come in without a doctor's
Yes.
referral like that one? Yeah.
We look at a patient and decide whether we need a doctor's permission
Yeah.
to work on them.
So
or-
that's your evaluation.
That's correct.
Of what's going on, how severe the patient may be. Anything you'd like to add to let our viewers know about what you do and where you're at and how you can help them?
Well, one thing we'd like to tell them is it's not that far to Jasper.
True.
It's a beautiful
That's
drive
true.
this time
It
of year.
is.
Yeah.
It is.
And then do you have a, why don't you go ahead and tell us where in Jasper you're located and how people could contact you?
You're better at directions than I am.
We're on South Street, and it's 100 West South Street, and it's in Jasper, Arkansas, just off the square 2 blocks, and it's very easy to find.
You're on a corner, I would assume.
We're actually 1 block off of Highway 7.
We're one
Okay.
building
Okay.
off of
Okay.
7.
Okay.
Okay.
And our telephone number, of course, is 870-446-2022.
And we've got that up on the screen for people to write down.
Great. And when Ellen had mentioned that it's not too far to come from this area, we've actually had clients come as far as Shreveport, Louisiana, just for treatment.
Kansas City.
Kansas City.
Several
Well,
places.
the type of treatments that you give, I mean, what area do you cover? I mean, are there other people like you in other areas? I mean, you say you have people come from other states, or
You might address it.
I'm not sure of the question.
the kind of therapy you do? Are there people all over that do the same kind of therapy, or are you pretty well exclusive to this area?
We're exclusive to this area,
Okay.
but there are other people.
So you,
Okay.
if you're wanting to, if you've had pain in the past and want a new approach, they might want to at least consult with you.
Yes.
That's correct.
correct.
Okay.
And probably the biggest thing that the audience might want to consider is we're not just a pain and stress management clinic. We do a
Okay.
lot of that, but we're also doing very good fine work for relaxation, for massage
Okay.
therapy.
Okay.
Okay.
So they go hand in hand. with each other.
Exactly.
Yeah.
And if they don't have any pain, come to relax.
Okay. All right. Well, we appreciate you, and I will ask you to come back
Thank
again,
you.
maybe do a demonstration, or maybe tell us a little more in
We have a
detail.
volunteer.
Yeah, there we go, right there. Thank you very much. Nice to meet you.
Thank you.
Thank
Nice
you.
to have met you.
All right.
Thank you.
Up next, we're going to be talking with Bud Pelser, and he's going to give us an update of what's happening down there at Dog Patch USA, and also an event that's coming up this weekend. Stay with us.